Hello everyone, I am Dr. Vikas Shettar, nephrologist at Narayana Multi-Speciality Hospital, Mysore. Today I will be briefly discussing regarding one of the important signs in medical field, that is called edema. Edema means there is swelling of the various parts of the body. The edema literally means accumulation of fluid in certain body parts. Okay, how to detect this? Most of the times patient comes out with this symptom like swelling in various body parts. Edema usually we see in dependent parts of the body. Mainly when patient is ambulatory, we see edema in the ankle region, that is called pedal edema. Edema can also be seen in various other parts of the body also. When patient is bedridden or non-ambulatory, we can see sometimes edema over the back region, that is called sacral edema. What is edema? Edema is usually accumulation of extra fluid in the body. Whenever there is excess of fluid due to various reasons, I will be discussing about the causes of this edema later. Whenever there is an accumulation of fluid in various body parts, it manifests in the form of swelling. It could be in excess of fluid in the body, or it could be due to inflammation in the body parts. Okay, how to detect edema? Usually when it will be sometimes very obvious to the patient that there is swelling in the legs and ankle region, that is called pedal edema. When we examine the patient, usually we see a pitting kind of edema. When we put a light pressure over the that particular body part, we can see a kind of depression that is called pitting type of pedal edema. There are other type of edema also. We call it as non-pitting type of pedal edema, that we see in some medical conditions like hypothyroidism, where we call it as a mixed edema. That is slightly different from the classical pedal edema due to various causes involving kidney, heart and liver diseases. Okay, how this edema develops? As we know, generally 60% of our human body comprises of water. This water is distributed between intracellular space and extracellular space. The fluid present within the cells is called intracellular fluid. Whatever the fluid which is present outside of the cell is called extracellular fluid. This extracellular fluid is again distributed into vascular compartment and interstitial space. Vascular compartment is what we see in the circulating in the form of blood. This is present inside the blood vessels. This helps in carrying the oxygen to the various body parts, tissues, helps in maintaining oxygenation to the various body parts. So this is intravascular compartment. We see a compartment in between the tissue and cells. This is called as interstitial space. Whenever there is an excess of fluid accumulation in the body, it extravasates into the interstitial space, where it manifests in the form of edema. Okay, what are the causes of edema? Edema is caused by organ dysfunction of various etiology. Mainly the kidney disorders. Kidney disorders are the important cause of edema. So how it is developed? What is the cause? Whenever there is any kidney disorders, when the glomerular filtration rate comes down, that is decreased in the kidney function, the filtration rate comes down, there will be salt and fluid retention in the body due to various counter-regulatory hormones, which will try to maintain the intravascular compartment with adequate volume and to maintain the tissue perfusion. Counter-regulatory mechanisms of various hormones will lead to salt and fluid accumulation in the body. Whenever there is excess of fluid accumulation in the body, salt and fluid accumulation, it usually appears first in the dependent portion of the body, that is in the legs, that is what we call as a pedal edema. So whenever a patient presents with this kind of symptoms, we need to look for what could be the cause of this edema. Either it could be renal disorders, or it could be cardiac disorders, or sometimes it could be due to diseases involving the liver also. When we coming to the kidney disorders, see in young patients we see a condition called as glomerulonephritis. This is the inflammation of the glomerulus, which is a part of the nephron, which is a functioning unit of the kidney. So whenever there is inflammation involving the glomerulus, we call it as a glomerulonephritis. Most of the time it is immune mediated. There will be immune complex deposition causing damage to the glomerulus. This leads to usually salt and fluid retention in the body and manifests in the form of edema, pedal edema. Okay. Then other conditions like especially in children, we see a condition called as nephrotic syndrome. Nephrotic syndrome is a condition where there is a protein leakage, massive protein leakage from the kidney. Even though kidney function may be well preserved, because of loss of protein in the urine leads to loss of colloidal oncotic pressure within the vascular compartment, leads to extravasation of fluid into the third space, that is fluid accumulates in the interstitial space, it accumulates in the peritoneal cavity, it accumulates in pleural cavity, that is what we call as a third space accumulation. Whenever there is a protein loss, low albumin is a kind of protein present in the blood which helps to hold the fluid within the vascular compartment. Whenever there is a albumin level is reduced because of nephrotic syndrome, it leads to edema. This we see commonly sometimes in children. This is a very much treatable condition. Early detection helps and early treatment helps in preventing further complications. And some of the chronic kidney disorders, progressive declinement in the kidney function over a long period, what we call as a chronic kidney disease. It is usually a progressive and irreversible change in the kidney. When they reach advanced stage, when glomerular filtration rate comes down significantly, again there will be fluid and salt accumulation in the body and manifests in the form of edema. And apart from kidney disorders, other conditions like liver disorders like cirrhosis of liver also can cause edema, and some of the heart related ailments, what we call as a congestive cardiac failure. When there is a cardiac dysfunction, pumping capacity of the heart is reduced, that is we call as a biventricular dysfunction, or sometimes even right ventricular disorders also can lead to swelling and edematous condition. This edema can be localized to one particular part, or it can be generalized. When it is generalized involving the large part of the body, it is called as anasarca, where fluid accumulates everywhere in the body, including pleura and peritoneal and other serosal cavities. So whenever patient presents with these symptoms, we have to approach the patient accordingly and find out what could be the cause. Simple tests pertaining to the kidney function like serum creatinine and urine analysis helps in detecting whether the edema is because of kidney disorders. So once if we come to know that it is kidney edema is secondary to kidney diseases, we can further evaluate the patient accordingly, and sometimes it may require a test called as kidney biopsy, especially if we suspect a glomerulonephritis. The kidney biopsy is a tissue, a bit of tissue is taken from kidney, and it is analyzed to find out what is the cause of the kidney diseases. So most of the time diagnosing underlying etiology and treating specifically according to the etiology will reduce the symptoms. Sometimes we will use a group of medications called as diuretics. Diuretics are drugs which will enhance urine output, enhance salt excretion through the kidney, and helps in getting rid of extra water. Generally, kidneys have got a large capacity to filter and reabsorb. Most of it is reabsorbed. As we know, kidney has the capacity to filter up to 120 liters of water per day, but 99% of it is reabsorbed. So, what is the role of diuretics? See, diuretics are a group of drugs which acts in the part of nephron called as loop of Henle. These are called as loop diuretics, where it will prevent absorption of sodium. When sodium reabsorption is prevented, water also flows through along with the sodium because of osmotic gradient, getting rid of excessive water and helps in relieving the congestion in the body. So diuretics mainly helps in symptomatic relief of the symptomatic treatment, but specific treatment has to be instituted for permanent alleviation of the symptoms. That requires further evaluation, and as I mentioned, sometimes kidney biopsy may be required to find out specific cause and then treat accordingly. So importantly, approaching the patient with edema is very important to find out what exactly is the cause of edema, whether it's a renal cause or non-renal cause. Other causes like congestive cardiac failure, cirrhosis of liver, these can be diagnosed by taking based on history and some physical examination and some of the laboratory parameters. So diuretics plays an important symptomatic treatment in this edematous condition, but most of the time patient needs to undergo specific tests and they have to consult appropriate specialist in evaluating, diagnosing and institution of specific treatment. Thank you.